Grace Pharmacy is the pharmacy without a cash register. Everything that we give out is free to the people. Grace Pharmacy has been in operation now for about 7 years. We're going on our 7th year. Filled over 36,000 prescriptions at no charge to people.
Grace Healthcare Services Corp vision is a world with less health disparity so that more people have the opportunity to reach their full potential. The mission is to provide needed healthcare services, including pharmaceutical products, to people who otherwise would lack access to that care.
Grace Healthcare Services is located on the campus of Grace Marketplace near the airport, East 39th Avenue in Gainesville. There's never an end to the line. People are always wanting services. When we try to close down at 2 o'clock, people are still wanting services.
I had volunteered at a number of free clinics. Very few of them actually provided medication. People could be seen. There was no access to inexpensive medication. So we formed the corporation to essentially get the license to open a pharmacy. In 2016, it was sort of a shoestring budget. We signed agreements with several of the free clinics. One of the initial ones was Helping Hands Clinic and the UF Mobile Outreach Clinic, Equal Access Clinic. We added UF Street Medicine.
Our mission in life is to improve the public health. There are segments of the population that are very hard to reach and who otherwise would not receive the health care they need. Places like this, especially this one, this is the hardest group to reach. It's very important for the public health mission for the community as a whole. It's critical that these places, these safety net clinics exist.
Grace Marketplace has tried to bring together all of the best services that we could find in the community. We try to find the agencies that are doing the best possible work and bring them in as our partners, working with the same population in the same location, but delivering completely different services. The work that Grace Healthcare did during the pandemic was the difference between us having to shut down on account of endless COVID outbreaks and us being able to consistently deliver our mission to people who truly had no place else to go.
Grace Pharmacy is open Monday through Friday from 1 to 5. We're closed on major holidays. We have about 250 different drugs on our formulary that the physicians can prescribe. With funding, we'd be able to expand that. We started about 7 years ago, and then we added on the clinics that we are now running out here.
We are a complete free medical clinic. We don't bill insurance, so we don't even ask about insurance. So we have people that have insurance, but for some reason can't access healthcare. Maybe it's a transportation issue. We have people on Medicaid, new to the area and don't have an assigned provider in the area, and then just people who have no access to medical insurance. We operate here on Mondays, and we're actually starting a Friday clinic as well. We see patients between 10 and 2. Twice a month we run a women's health clinic.
Over 90% of women who are experiencing homelessness have experienced sexual or physical violence.
Women who are experiencing homelessness have an increased rate of morbidity, illnesses, and mortality. Women who are unhoused have a 3.5 time likelihood of dying early compared to housed women.
It's a women's only, truly no providers are male, so it gives the women a safe space to seek their medical care.
We serve not only people who are here at Grace, but anyone else who's low income, uninsured, in need, or seen by any of our clinic partners.
Dr. Rawling and his nurses and his level of care was just amazing. And the fact that I couldn't afford prescriptions, the fact that he would call my home and check on me, just been truly amazing.
People in this particular community suffer from a lot of different chronic disease states, and by giving them access to health care at the clinics, access to medications at zero cost, allows them to stay on top of their health. We have a pretty large formulary, anything from mental health to cardiac, diabetes, and these are all chronic conditions that people here are dealing with. They know that they need this medication, maybe even to sustain life, and they're very grateful to be able to have the access to this.
You know, there's a lot of diseases and stuff out there, and there's a lot of people who have a lot of health conditions. I had a little health scare, and I wasn't able to afford my medication. I was able to come here to the clinic and get my medications.
Well, Grace Healthcare Services and Grace Pharmacy, we would like to expand, one, the formulary that we use. We'd also like to be able to increase the hours of operation, but that's all based on funding and donations. Gotten a couple of small grants, primarily through personal donations that we were able to operate.
I'd like us to be able to expand services beyond what we do out here to get more people in the community to recognize what we offer the community. We accumulate money to pay for the drugs. All the labor, the facilities are all for free, but somebody's still got to pay for the drugs. And a lot of that's done either through WUFT, mobile clinics. There are more organizations like that. I want more of them aware so that they can contribute as well and extend our services to more people.
You can go to the website, gracehealthcs.org, different pages for programs that we have. So there will be a donate button.
We run with what we have. Donations are always welcome. There are always supplies that we need. And then volunteers. We have an amazing breadth of volunteers. We have some retired nurses. We have students who are interested in going to medical school that just want to get an experience working with patients in a clinical setting. It's really a rewarding place to feel like you're giving back.
There's tremendous need. People shouldn't have to choose between their medications and buying food for their families, and we're here to help.